Good afternoon. This is Pam Gaither. I'm the Executive Director at the Galesburg Area Chamber of Commerce, and we are so excited. I have to look at my notes, so I'm familiar with Graham, but I have to memorize this. The Knox and Fulton County Wound Clinic and Hyperbaric Medicine, right?
That's correct.
We are so proud. Thank you so much for everyone here from Graham for bringing this to our community. I want to introduce Adrienne. She is the Hyperbaric Safety Director here and in Canton as well. So, Adrienne, first of all, thank you for being here.
Thanks.
And thank you for what you do to train everyone to use this equipment, too. We were talking ahead of time. You guys gave us a little bit of a tour. It's super amazing. And you probably will show anybody, right, what you do here. So, let's talk about this. You just fresh opened the doors, right?
Correct.
Exactly. So, what this brings to our community, let's talk about some of the things, those benefits that this opportunity gives the folks here in Knox County.
So Hyperbarics is getting 100% oxygen into your blood system, just to kind of make it easy. So most of the people that we see are diabetics and issues like that. So being able to see those patients, our Hyperbarics is kind of a last-ditch effort to, if we don't have any other options, that's a way we can kind of help people along.
You talked about diabetics, the wound clinic side of things. I mean, it's separate. Is that separate? The wound clinic is separate, or is it all the same?
It's all the same thing.
It's all the same. And I saw this equipment. It's amazing. You have 2 chambers.
Yes.
And let's talk about that process really quick. It's not something that I can say, hey, can I just pop in and get better real fast?
No.
So let's talk about that.
So when you come in, you have a 90-minute treatment time. So it's 90 minutes, 5 days a week for somewhere between 6 and 8 weeks, depending on why you're coming in.
And why is it that length of time? Because I think maybe the misconception is that it's maybe a fast turnaround, like we talked about. It's not go get a tan real fast, right?
No. It takes 3 consecutive days to get to a clinical level of oxygen in your system. So if you can do the 3 days in a row, by the time you hit day 4 and 5, then you would be off for the weekend. Then your clinical level would come back down. You would start again that Monday and be able to build back up from there.
Yeah. And we talked about you have criteria that the patient has to meet ahead of time.
Right.
So they had to have done a little bit of work to try to get better first.
Right.
So why don't we talk through how that looks and what someone may be looking to come here, what process that might look like.
So you would come in, if you did have a wound, you would come in, you would see our provider. You would deal with the nurses and our provider beforehand. You would do 4-ish, somewhere around weeks of clinical treatment beforehand. So you're looking at debridements and antibiotics and things like that. You would go through all of that. If you still weren't healing, then you're going to come towards my desk. And then we kind of have a conversation from there and see if it would be beneficial for you or not.
And these are pretty serious matters that someone's coming here with wound care that they need, that they are not getting answers otherwise.
Right.
And sometimes, like you said, it's maybe right before the decision to amputate.
Yes.
And you guys are able to prevent that from happening.
Right.
I mean, this is like miracle work that you're doing here. So
yeah, a lot of times it's kind of our last ditch effort before someone has to go in for a major surgery or an amputation or something like that.
So, and I'm sure you're welcome to have someone call, check in to see what it's like. If somebody's interested or a family member has someone that has an injury that maybe they would be interested to see how this would work for their family, right?
Yeah.
Yeah. Well, I want to say thank you. Do you want to introduce any of the folks here?
Our whole clinical team is kind of right behind us. This is Scott. He's our program director. Linda is one of our nurses. Jana, one of our nurses. Tori is our safety director. Tori is our clinical director. And Renee is our provider.
Awesome. So, well, I want to say thank you again. I want to thank Graham Health System for the investment in the Knox County area, expanding that investment even further. It's impressive what you've done, and we are so excited you're here. I want to thank everybody in the crowd that is behind me from Chamber Ambassadors. We have KCAP represented, Economic Development, just a lot of friendly folks, the board members from the Chamber of Commerce too. We got Shaney from Representative Dan Swanson's office here as well. So thank you everybody for being here, and anything else you'd like to add?
I don't think so.
All right. Well, let's cut this ribbon. I want to say we do have a confetti cannon over here, Zach. First Mid-Bank and Trust is our sponsor of our confetti cannon. Adds a little extra fun to the whole event. So beware of that. And we'll count down from 5 if everybody can help me out. Ready, Tori? Oh, yes.
Okay.
All right. 5, 4, 3, 2, 1. Woo! It's all right. We can't control the wind. Oh, it's swirling.
Yes.
Kind of fun. Hey, thank you so much.
Yeah. Seriously, you're welcome.
So impressed.
Thank you. That was awesome.